Hello, my name is Mitchell Lacey. I am a medical student at Florida International University Herbert Wertheim College of Medicine, and I am representing the Baptist Health South Florida Breast Oncology team. And I would like to have the opportunity to present a unique case we encountered during rotations to you as it was presented to us, revealing an oscillating course of progression and remission in a patient with HR-positive, HER2-low lobular breast cancer with bone marrow involvement in the resolution of pancytopenia with trastuzumab and deruxtecan. From Darkness to Dawn: A case report of resolution of pancytopenia with trastuzumab deruxtecan in a patient with metastatic HER2-low lobular breast cancer with bone marrow involvement. Invasive lobular breast cancer is a subtype of breast cancer that is characterized by its unique growth pattern and histological features. Bone marrow involvement is a rare condition, and an unusual presentation of pancytopenia is outlined in our case. And you can see some of the biopsy results from the H&E and the estrogen receptor immunohistochemistry stain. We present a case of a 70-year-old woman with a past medical history of hypertension, hyperlipidemia, and osteoarthritis who was diagnosed with metastatic hormone receptor positive, HER2-low invasive lobular breast cancer with lymph node and bone metastasis at age 67. She was initially started on first-line endocrine therapy with letrozole and palbociclib, but the decision was shortly changed to capecitabine due to suspected progression despite the stable scans. The patient's anemia had further worsened, requiring multiple transfusions, and she later developed thrombocytopenia. In our chart, you can see the first line with the red arrow, and then the capecitabine with the light blue arrow, and how those trends dropped with platelets. And then the tumor markers were fairly stable at that time, and same with the scans. But hemoglobin was fairly stable, but there was suspected progression. Second line with fulvestrant was initiated shortly after discontinuing endocrine therapy, but her tumor markers and circulating tumor DNA started to rise despite stabilization of restaging scans. She further developed worsening anemia, and peripheral smears showed nucleated red blood cells. At this time, restaging scans showed progressive disease and previous findings in the development of new liver metastasis. Previous bone lesions remained stable from previous imaging. You can see here that's when the fulvestrant was started at about 14 months, and that's when the tumor markers started to rise. Platelets were fairly stable at that time, but the hemoglobin was dropping significantly. Due to these findings, bone marrow biopsy was performed, which showed a 100% involvement of the bone marrow with metastatic invasive lobular carcinoma. It was decided to start the patient on dose-reduced paclitaxel, and her pancytopenia initially improved, but was short-lived. After a few months, she had progression of disease. You can see after the paclitaxel, the thrombocytopenia stabilizes, but it did drop eventually right after. Since her tumor was HER2-low, she was started on newly approved therapy trastuzumab deruxtecan. After a few months, her anemia drastically improved and the thrombocytopenia resolved. You can see here that the hemoglobin started to go up nicely, tumor markers were stabilized, and then really nicely the platelets started to rise drastically. As you can see, this case highlights the unique development and unusual presentation of metastatic HR-positive, HER2-low invasive lobular breast cancer with bone marrow involvement leading to pancytopenia. Treatment course proved challenging due to the developing pancytopenia and poor response to several therapies. However, trastuzumab deruxtecan was given, and she had partial response to therapy. Remarkably, after initiation, the patient's anemia significantly improved and thrombocytopenia completely resolved. To our knowledge, this is the first case report in the literature of stabilization of the bone marrow in a patient with HER2-low breast cancer treated with trastuzumab deruxtecan. Pancytopenia in breast cancer limits the available treatments patients can receive. Patients with pancytopenia are often excluded from clinical trials, and we cannot evaluate the safety and efficacy of treatments in patients with low blood counts. We found that trastuzumab deruxtecan was safe and effective in a heavily pretreated patient with HER2-low metastatic breast cancer with pancytopenia secondary to bone marrow involvement. This targeted therapy successes highlights the importance of personalized treatment approaches to breast cancer. Thank you.